You wake up in the morning and your mouth feels extremely dry. Your lips are cracked, your tongue feels stuck to the roof of your mouth, and the first thing you reach for is the glass of water beside your bed. This happens every single day. Maybe you've mentioned it to your doctor and they brushed it off as something that comes with age. Or maybe you've just accepted it as a normal part of getting older. But what most people don't understand is this: waking up with a dry mouth every morning is not a normal part of aging. It's actually your body signaling that something specific is happening while you sleep. In adults over the age of 60, this usually points to one of 5 distinct causes. And at least one of these causes could be affecting your overall health right now without you realizing it. I'm Dr. Olivia Collins, and this channel focuses on sharing the latest evidence-based research on senior health in a way that's practical and easy to understand. If you haven't subscribed yet, consider doing so to stay updated with our content. Now let's understand what your dry mouth could really mean. Saliva is something we rarely think about until it becomes a problem. Your body produces around 1 to 1.5 liters of saliva every day. It helps protect your teeth, neutralize acids, assist in swallowing, fight harmful bacteria, and even support digestion. When saliva production drops significantly during sleep, it should not be ignored. It's a warning sign, not just a minor discomfort. Research strongly supports this. A study published in 2022 in the journal Gerontology found that chronic dry mouth affects up to 46% of adults over the age of 70, making it one of the most common oral health issues in seniors. But here's the important part. The same study found that in most cases, xerostomia, the medical term for dry mouth, is actually a symptom of an underlying issue rather than a condition on its own. So what are these underlying causes? Let's go through them, because identifying the right one could significantly impact your health. The leading cause of morning dry mouth in older adults is medication. This surprises many people. More than 400 prescription and over-the-counter medications list dry mouth as a side effect. That includes drugs commonly used by seniors, such as antihistamines for allergies, diuretics for blood pressure, antidepressants, medications for bladder control, certain heart drugs, and even sleep aids. A 2020 review published in the Journal of the American Geriatric Society found that seniors who take 3 or more medications are 63% more likely to experience chronic dry mouth compared to those taking fewer medications. Considering that the average American over 65 takes 4 to 5 prescription medications daily, along with supplements, the combined effect can be significant. If your symptoms began around the time you started a new medication, there is a strong chance the two are connected. You can also share how many medications you are currently taking, as this helps highlight how common this issue really is. Now, the second major cause is more serious, so pay close attention. It affects around 39 million Americans, and many of them don't even know they have it. This condition is obstructive sleep apnea. Sleep apnea occurs when your airway becomes partially or completely blocked during sleep. This forces you to breathe through your mouth instead of your nose. Breathing through the nose helps maintain moisture in the mouth and throat, while mouth breathing causes saliva to dry up quickly. This is why you wake up with that intense dryness. More importantly, sleep apnea itself carries serious health risks for older adults. Research published in the Journal of Clinical Sleep Medicine found that untreated sleep apnea in individuals over 60 raises the risk of stroke by 60% and increases the likelihood of major heart disease by 40%. If you snore loudly, if your partner has ever observed you briefly stop breathing during sleep, or if you regularly wake up feeling tired even after a full night's rest, then your dry mouth may actually be the least concerning symptom. Let me share the story of Margaret. She was a 68-year-old retired teacher who had been dealing with severe dry mouth every morning for almost 3 years. She tried multiple oral sprays, kept water beside her bed, and reduced her caffeine intake. Her dentist also noticed increasing tooth decay that seemed to develop unexpectedly. When she eventually came in for a detailed evaluation, we were able to link her dry mouth to a pattern her husband had been noticing for years, without realizing its importance. She was briefly stopping her breathing during sleep. Margaret was diagnosed with moderate obstructive sleep apnea. After starting CPAP therapy with a humidifier, her morning dry mouth almost completely disappeared within 6 weeks. Her blood pressure, which had been gradually rising over the past 2 years, also showed clear improvement within 3 months. The third cause is diabetes, whether diagnosed or not. High blood sugar levels cause the kidneys to draw fluid from body tissues in an effort to dilute and remove excess glucose. This leads to overall dehydration, which directly reduces saliva production. A 2021 study from the National Institutes of Health reported that 83% of individuals with poorly controlled type 2 diabetes experienced frequent dry mouth as an ongoing symptom. Here is a statistic that should catch your attention. About 1 in 3 adults with diabetes in the United States is currently undiagnosed. That means many people have the condition without knowing it. If your morning dry mouth is combined with frequent urination, unusual tiredness, blurred vision, or slow-healing wounds, you should make it a priority to get a fasting blood sugar test this week. The fourth cause is chronic dehydration, and it affects seniors differently than younger individuals. This is important to understand. As people age, the sensation of thirst becomes much weaker. Your body may be significantly low on fluids without sending the same warning signals it once did. Research from the European Journal of Nutrition confirmed that adults over 65 are often chronically underhydrated compared to younger people, frequently without even feeling thirsty. Your dry mouth in the morning may simply be the most noticeable sign that your body has been lacking sufficient fluids throughout the day. The fifth cause is Sjogren's syndrome, an autoimmune disorder that directly targets the glands responsible for producing saliva and tears. About 90% of those diagnosed with Sjogren's are women, and it is most commonly identified in the late 50s to early 60s. It is often underdiagnosed because its main symptoms, dry mouth and dry eyes, are commonly mistaken for normal aging. If your dry mouth is accompanied by persistent dry or gritty eyes, unexplained joint discomfort, or a level of fatigue that feels excessive compared to your activity level, Sjogren's syndrome is something you should discuss with your doctor. Here is what you should do with this information. The first step is a medication review. Make a list of every prescription medication and supplement you take, including over-the-counter products. Take this list to your doctor or pharmacist and ask directly, could any combination of these be causing or worsening my dry mouth? Also ask whether any medication could be adjusted, replaced, or taken at a different time to reduce its effects during the night. This single discussion has helped many of my patients resolve morning dry mouth without making any changes to their actual treatment. Step 2 is evaluating sleep quality. For the next 7 days, keep a small notebook next to your bed. Each morning, note whether your mouth was open or closed when you woke up, whether you feel well rested or still tired, and if possible, ask your partner whether they notice snoring or any pauses in your breathing during the night. If you begin to notice a repeating pattern, ask your primary care physician for a sleep study referral. Many insurance plans fully cover sleep studies for people over 60, and nowadays the test can often be done comfortably at home. Step 3 is checking blood sugar levels. If you have not had a fasting glucose test or HbA1c test within the past year, you should schedule one now. The HbA1c test shows your average blood sugar levels over the past 3 months. It takes only a few minutes and may detect an early issue that your dry mouth has been quietly indicating for some time. Step 4 is improving hydration habits. Start by drinking about 16 ounces of water spread over the 2 hours before going to bed, rather than all at once. Also increase your total daily water intake to at least 64 ounces, distributed throughout the day. Set reminders on your phone if needed. Do not rely on thirst as your guide anymore, because that signal becomes less dependable with age. Step 5 is for immediate nighttime relief while you investigate the underlying cause. Consider using a mouth rinse or oral gel that contains xylitol. Products such as Biotin Dry Mouth Oral Rinse or ACT Dry Mouth Rinse are available at pharmacies like CVS, Walgreens, or Target. Use it just before going to bed each night. Xylitol also offers mild protection against bacteria in the mouth while you sleep. Avoid mouthwashes that contain alcohol, as they can significantly worsen dryness. One important safety warning: if you are taking blood thinners, ACE inhibitors, or lithium, speak with your doctor before making major changes to your fluid intake, as changes in hydration can affect how these medications work in your body. Also, if your dry mouth is accompanied by mouth pain, difficulty swallowing, white patches inside the mouth, or unexplained weight loss, you should see a doctor as soon as possible rather than waiting for a routine visit. Morning dry mouth is common, but common does not always mean normal. In most cases, it is linked to a clear and identifiable cause: medications, sleep apnea, blood sugar problems, dehydration, or an autoimmune condition. All of these can be addressed. Now you know what to look for and what questions to ask. Comment below with one of these 3 answers so others can see where people are starting from. Type medication if you think your prescriptions may be the cause. Type sleep if you suspect breathing issues or sleep apnea. Or type getting tested if your next step is scheduling a blood sugar test. I read every comment, and your responses help guide future topics I cover. If this video helped you understand something your doctor may not have fully explained, subscribe so you don't miss next week's video, where we will discuss warning signs that a common cholesterol medication may be causing more harm than benefit in some seniors over 60. It is a subject that raises many questions and deserves a clear and honest explanation. Take care of yourself. You now have the knowledge to do exactly that.